Have you ever wondered why, despite taking your calcium pills every single day and drinking glasses of milk faithfully, your bones are still getting thinner? It is a terrifying realization when you stand in the doctor's office, looking at a bone density scan that shows your skeleton is becoming as fragile as a piece of dry coral. You did everything right. You followed the advice, yet your back still aches, your posture is stooping, and the fear of a single trip or fall shattering your hip keeps you awake at night. This is the calcium paradox, and for millions of seniors, it is a silent tragedy unfolding inside their bodies right now. Recent health news reports have highlighted a disturbing trend, a massive spike in calcium-related heart issues among the elderly. Doctors are finding that in many patients, the calcium they swallow isn't reaching their bones at all. Instead, it is wandering aimlessly through the bloodstream, eventually hardening inside the arteries or forming painful stones in the kidneys. It's like ordering a shipment of bricks to repair a crumbling house. But the delivery driver leaves them piled up in the hallway, blocking the doors instead of fixing the walls. You are literally stony on the inside, but hollow in your bones. Imagine the pain of a grandmother who can no longer pick up her grandchild because she is terrified her spine might fracture. Think about the active grandfather who suddenly faces a life in a wheelchair because a simple slip in the kitchen turned into a permanent disability. These aren't just stories. They are the reality for 1 in 3 women and 1 in 5 men over 50. The pain isn't just physical. It's the emotional toll of losing your independence, of feeling your body betray you even when you tried to take care of it. The truth that the big supplement companies often fail to mention is that calcium is not a solo performer. Without the right directors to tell it where to go, calcium can actually become a toxin to your cardiovascular system. You might be supplement heavy, but nutrient starved. In the next few minutes, I am going to reveal the missing links, the 2 specific, inexpensive nutrients that act as the GPS for your calcium, ensuring every milligram goes exactly where it belongs, into your bones to keep them strong, dense, and youthful. If you want to stop the silent theft of your bone health and protect your heart at the same time, you cannot afford to miss what I'm about to share. Would you like me to continue with the next section of the script, focusing on the scientific explanation of vitamin D3 and K2? So, why is this happening? Why is the very mineral meant to save your life potentially causing you harm? As a doctor, I see this confusion in my clinic every single day. Patients come to me with a bag full of supplements, looking me in the eyes with genuine worry, asking, "Dr. Emily, I'm doing everything you told me, so why do I still feel so weak?" The answer lies in a fundamental misunderstanding of how our bodies process minerals. It isn't just about what you swallow, it's about where it lands. Let us look at the first and most critical reason. The missing GPS is for your calcium. The first reason your calcium isn't working is a lack of vitamin K2. Think of calcium as a powerful but directionless traveler. Without vitamin K2, it has no map. In the medical world, we call K2 the biological traffic cop. Its job is to activate a specific protein called osteocalcin, which literally anchors the calcium into your bone matrix. But here is the dangerous part. If K2 isn't there to pull calcium out of your blood, that calcium starts to settle in your soft tissues, your heart valves, your kidneys, and your arteries. You end up with calcification, a condition where your blood vessels become stiff like old pipes. I want you to take a moment and think. Have you ever been told you have high blood pressure or stiff arteries despite taking your bone supplements? This could be exactly why. We are trying to build a bridge, but we forgot the workers who actually lay the stones in place. Shutterstock. The second reason is the vitamin D3 doorway problem. Many of you might already be taking vitamin D, and that's a great start. However, the relationship between D3 and calcium is often misunderstood. Vitamin D3 is the key that opens the door in your intestines to let calcium into your bloodstream. Without enough D3, you could swallow a mountain of calcium, and it would simply pass through your system wasted. But here is the catch that I see many people miss. D3 increases calcium absorption so effectively that if you don't balance it correctly, you can end up with a toxic level of calcium in your blood. It's a delicate dance. Are you taking your vitamin D in the morning with a healthy fat, or are you taking it on an empty stomach where it might not even be absorbed? I'd love to know in the comments. What does your current supplement routine look like? Understanding your habits helps me give you better advice. Finally, the third reason is the often ignored magnesium balance. Your body is a symphony of minerals, and calcium is just one instrument. If you have too much calcium and not enough magnesium, your muscles, including your heart, can't relax. Magnesium is what keeps calcium dissolved in your blood so it doesn't turn into stones. Think of it like salt in water. If you put too much salt in a small glass, it settles at the bottom. Magnesium increases that solubility. When you are stressed or eating a highly processed diet, your magnesium levels plummet, leaving your calcium to turn into debris in your body. This is why many seniors feel stiff and crampy even while taking bone boosters. We need to stop looking at calcium as a magic bullet and start seeing it as part of a team. I share this because I want you to feel empowered, not afraid. You have the power to change how your body ages, starting with your next meal or supplement. If this explanation is making sense to you so far, please give this video a thumbs up. It helps me know that this science-made simple approach is truly helping you. Would you like me to wrap this up with part 3, focusing on the specific golden formula and the daily routine you should follow to fix this? Now that we understand why the traditional approach to bone health is failing so many of us, I want to share a story that illustrates exactly how these pieces fit together in real life. A few years ago, a patient of mine named Margaret came into my office. At 72, she was the picture of health in every way except for one, her bones. She was diligent, taking 200 milligrams of calcium daily for a decade. Yet her latest DEXA scan showed her bone density was still plummeting into the danger zone of osteoporosis. Worse, she was suffering from chronic calf cramps and had recently been diagnosed with early-stage arterial stiffness. She was terrified, crying in my office, saying, "Dr. Emily, I've done everything the labels told me to do. Why is my body failing?" Margaret's story is the perfect example of the golden formula in action. We didn't just give her more calcium. In fact, we actually lowered her calcium supplement dose and focused on the synergy of the big four: calcium, D3, K2, and magnesium. Within 6 months of adjusting her protocol to include specific K2-rich foods like fermented natto, and a high-quality D3 supplement taken with her largest meal, the change was miraculous. Her cramps vanished almost overnight because the magnesium was finally allowed to do its job. A year later, her follow-up scan showed her bone density had stabilized for the first time in 10 years. Her arteries were no longer showing signs of further hardening. She didn't need a miracle. She just needed a GPS for her nutrients. So, what is the practical golden formula you can start today? First, we must stop the calcium megadose myth. Your body cannot absorb more than 500 milligrams of calcium at a single time. If you take a 1,000 milligram pill, the rest is just left to wander through your arteries, causing trouble. Split your intake. Focus on getting as much as possible from food. Think dark leafy greens, sardines with the bones, and organic dairy. When you do supplement, ensure it is paired with at least 180 micrograms of vitamin K2 in the MK7 form. This specific form of K2 stays in your blood longer, acting like a constant sentry, guarding your heart and guiding that calcium into your hips and spine. Next, let's talk about the D3 sweet spot. Clinical studies published in the Journal of Internal Medicine have shown that people with higher blood levels of vitamin D have a significantly lower risk of hip fractures, but only when vitamin K2 levels are also adequate. I recommend most of my patients aim for 2,000 to 5,000 IU of D3 daily, depending on their blood tests, but always taken with a meal containing healthy fats like avocado or olive oil. Without that fat, the D3 key never makes it into the lock. And don't forget your magnesium. 300 to 400 milligrams of magnesium glycinate before bed can be a game changer for your sleep your muscles, and your bone mineralization. I want you to look at your supplement bottles tonight. If your calcium bottle doesn't mention K2 or D3, it might be time to rethink your strategy. You aren't just a collection of bones. You are a complex, beautiful system that deserves to be treated with scientific precision and care. You deserve to move without fear, to stand tall, and to know that your heart is as protected as your skeleton. This journey to health isn't about expensive, quick fixes like Botox or high-priced creams. It's about returning to the foundational logic of how your body actually works. If Margaret's story resonated with you, or if you've felt that same frustration of doing everything right without results, please share your experience below. Your story might be the very thing that encourages someone else to make a change that saves their life. And if you want more of these deep dives into the science of aging gracefully, make sure you are subscribed. It is an honor to be part of your health journey. I have completed the full script for you. Would you like me to create a set of short scripts based on these 3 parts to help drive traffic to this main video? As we close this chapter today, I want you to take a deep breath and realize that aging does not have to mean breaking. The fear of fragility is a heavy burden to carry, but now you have the knowledge to set that burden down. We have spent years being told that health is found in a single pill or a high-priced miracle cure. But as we've seen, the true secret lies in the harmony of nature and the precision of science. Your bones are living, breathing tissues that are constantly listening to the signals you send them. By providing the right GPS through vitamin K2, the doorway of D3, and the balance of magnesium, you are doing more than just preventing a fracture. You are reclaiming your freedom. I want you to imagine yourself 5 or 10 years from now. I see you walking through the park with confidence, playing with your grandchildren without a second thought about your back, and standing tall with the posture of someone who is truly nourished. This isn't just a dream. It is the direct result of the small, smart choices you start making today. You have the power to turn your body from a source of anxiety into a vessel of vitality. Now, I have a specific mission for you. First, go to your kitchen and check your supplements. See if they are working for you or against you. Second, if you found this deep dive into the calcium paradox eye-opening, please hit that like button. It tells the algorithm that this life-saving information needs to reach more people who are currently struggling in the dark. And most importantly, if you haven't already, click that subscribe button and turn on the notification bell. In our next session, I'll be revealing the top 5 anti-inflammatory foods that work better than ibuprofen for joint pain. You don't want to miss it. Thank you for trusting me with your health journey. I am Dr. Emily-Hartwell, and I'll see you in the next video. Stand tall, stay strong, and remember, it is never too late to give your body what it truly needs.